Hello, my name's Anne Mays and I'm the Children's Diabetes Nurse at the Leicester Royal Infirmary, and we're here today to talk about type 1 diabetes. So what is type 1 diabetes? It is a condition where the pancreas, a gland in the body, no longer produces hormone. The hormone is insulin. The body's immune system becomes confused and it starts attacking the insulin producing cells by mistake. As a result, your body has too few of these cells left, and it's not because you've eaten too many sweets, which is the common fallacy. Sometimes people get confused between type 1 and type 2 diabetes, type 1 and type 2. Type 2 diabetes is more common in adults or young adults. The pancreas doesn't make enough insulin, or it doesn't work as well. Type 2 diabetes can be managed through having a very healthy diet or having medication or sometimes injections. When we eat food containing carbohydrates, predominantly starch and sugars, it produces glucose, which is transferred from the stomach into the bloodstream and then into the cells to provide energy and to maintain normal blood glucose levels. So insulin is responsible for this process, and it acts as a key. It opens the cell doors and allows the glucose to enter. Without insulin, more and more glucose will build up in the bloodstream and your body will try to get rid of it through urine. This makes you go to the toilet much more frequently, and it often makes you thirsty. Other symptoms can include weight loss, lethargy, abdominal pain, difficulty in concentrating, and sometimes behavioural changes. So the government has put out a scheme whereby you can recognise the 4 T's. That is being thin, being tired, increased thirst, and increase in going to the toilet. Unfortunately, type 1 diabetes cannot be cured, but it can be treated effectively in most children with multiple daily injections of insulin. Multiple daily injections allows flexibility around your meals, snacks and food choices. All diabetic children will have the need to test their blood glucose levels regularly, at least 4 times a day, usually before meals and bedtime.
This part is about insulin, the types of insulin you may have, how to prepare an injection and how to change the vial in your pen. You may have 2 types of pen, a blue pen and a red pen. The blue pen contains Levemir, which is your long-acting insulin. You will not see this pen at school. The pen you will see at school is this one, which is your short-acting insulin, usually called Nova Rapid. The insulin is contained in the pen in a vial, which looks like this in the pen, like this. To change the vial, you remove the lid and the pen comes in 2 parts. The insulin vial can be placed into the pen like so. Please do not worry because you cannot put it in the wrong way round. Pop the vial in, push it together and click into place. The insulin vial should be changed once a month. And once the vial is in your pen, it does not need to go in the fridge. How to do an injection. This is a pen that you will use for your injection, and this is the needle. Needles come individually wrapped. First thing to do is to remove the foil from your needle and place it on the end of your pen like so. Twist it into place and stop when you feel it tighten. Remove the clear cover remove the green cover. Please do not put this cover back on. This needle currently contains air, so we need to prime the needle to start off with. We do that by pulling the plunger out at the end and dialing up to number 2. The pen goes up in half units. We squirt the insulin out of the pen, either over at the sink or into the cap. Please do not squirt this over flooring as it takes the colour out. Push the plunger at the end to squirt the insulin out, and you should see droplets on the end of the needle. Replace your cover to prevent any injury, and then you're going to dial up your dose. Again, by pulling the plunger out and dialing it to the required amount. In this instant, we're going to say we need 3 units. The next step is to identify where you want to give your injection. There are various places on the body that you can use. Tops of legs, the tummy, or the tops of the bottom. Children tend to favour their legs. To talk to you about meters and finger lancets. There are a selection of meters available. They both work in exactly the same way, in the way that they test your blood sugar. They come with a pot of strips. Take a strip out of the box and place it in the meter. These are the types of finger lancet devices you may have, this being the most common. This finger lancet contains 6 needles, which are contained in a barrel at the end. The barrel is very easy to replace in that you remove it and put the new one in. All the needles are contained in the barrel so that they won't prick your finger when you replace it. The numbers on the end of the finger lancet indicate the depth at which the needle will pierce your skin. If you are a young child, your skin will be quite soft and therefore you won't need it on a very high setting, and number 2 is normally about right. This number here indicates how many clean needles you have, and we would suggest that you flick the white lever before each time you prick your finger to ensure you have a new and clean needle. There is a hole at the end of the finger lancet device, and this is what you need to line up on the side of your finger. We suggest that you avoid these fingers, the crocodile fingers, and use one of these fingers here. I'm rotating the site that you use. Please use either side of your finger, no lower than the nail bed, and please avoid the pads as this will really hurt. Checking where the hole is, if you line that up on the side of your finger and press the plunger at the end. This will make a little noise and will prick your finger very quickly, and it should not hurt. A small speck of blood will appear if you just squeeze your finger to let the blood come out and then hold it to the bottom of your strip, like so, on whichever meter you're using. The differences between the meters are that this meter will just check your blood sugar. This meter goes a step further. It checks your blood sugar, and then you can use it to work out how much insulin you will need by calculating the amount of carbohydrate in your food and entering this into the meter. The meter is preset with insulin doses, insulin ratios, and therefore will indicate how much insulin you should take. Please follow the advice of the meter.
we're here to talk about what is a hypo. Hypoglycemia is a name given to those times when the blood glucose falls below normal, i.e. below 4 millimoles. A good way of remembering this is under 4 is the floor. Hypos are most often caused by one or more of the following factors, and a definite cause can usually be identified as too much insulin, not enough or delayed meal or snack, sudden or sustained exercise, illness, cold weather, anxiety. Sometimes it is difficult to know why you have a low blood glucose level. It may be necessary to examine your activity during the preceding 24 hours, as late onset hypos can usually have several hours before the physical activity. The brain needs glucose as a source of energy, and the lowering of glucose levels can quickly interfere with the brain function. The earlier signs of hypos are recognised, the easier it is to put right. Signs of a hypo may include sweating, headache, trembling or shakiness, hunger, lack of concentration, mood change, looking pale, glazed eyes, confusion, sleepiness, rudeness or aggression, tearful or feeling generally unwell. These signs and symptoms may vary from child to child, so it is important to check your sugar levels prior to confirming an hypo. Ensure your hands are clean and dry before testing your blood glucose, since inaccurate results can be given if they are wet or if there's sugar on the skin.
I take these dextro energy tablets and sometimes a little small can of Cokes that will hopefully bring me up, and I always check again after 10 minutes. The school is always there. If I am feeling low, I'd always go down to the medical room where the staff will always help me. If I can't check my bloods, then it's never happened before that I've been so bad, but I'm sure they'll be there to help me and support me if ever I need it. Take some more sugar and then recheck in 10 more minutes. But if my bloods are still not coming after 3-4 more times of sugar, I would probably ring the diabetes team and they will advise me on what to do. When my blood sugars are above 4, I would take something more that has more carbohydrates in it, so that it will be a bit slower to come up, but because I'm still getting there in a steady pace. I have 2 injection pens so I can take my insulin. The main symptoms are I sometimes have really shaky hands and legs, or just shaky everywhere. My vision can sometimes go a bit blurry, and sometimes I zone out and I can't stop zoning out. Like, some people can say a whole chunk of words to me and I will not register what they've just said. I feel a bit confused sometimes because, especially when the vision is blurry, you kind of lose track of where you are. Sometimes you don't know what to do, and it's kind of a struggle to get the things you need, especially if there's hardly anybody around. Hypo, one of the main things that I have is these energy dextro tablets and sometimes a little can of Coke.